A baby is born with a heart rate of 60 beats per minute. The baby is not breathing, has limp limbs, is flaccid and pale. What is the baby's Apgar score at 1 minute? A. 1. B. 4. C. 2. D. 8. E. 0. The answer is A. 1. An Apgar, appearance pulse grimace activity respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the Apgar scoring method, point allocations are as follows. Heart rate less than 100, 1. Poor flexion, 0. Absent reflex, 0. Apnea, 0. Pallor, 0. We add these individual scores to get the Apgar score of 1. A pair of new parents are concerned because their baby has lost 4% of its birth weight at 3 days of life. The nurse instructs the parents to dash. A. Consider switching brands of formula. B. Continue feedings as usual. C. Feed every 5 hours. D. Notify a pediatrician. E. Feed only breast milk until the infant's weight increases. The answer is B. Continue feedings as usual. It is common for infants to lose up to 10% of their weight in the first week of life. Greater than a 10% loss indicates a problem. For an infant within these parameters, there is no need to make a change in feedings. Infants in the first week of life should be fed every 2 to 3 hours if breastfeeding and every 3 to 4 hours if formula feeding. Julie is a new registered nurse who is assessing a child in his 3rd month of life. The assessment is part of a routine appointment at a public health clinic. She knows that the anterior fontanelle of most infants closes between dash. A. 18 to 20 months of age. B. 3 to 6 months of age. C. 1 to 3 months of age. D. 6 to 9 months of age. E. 12 to 18 months of age. The answer is E. 12 to 18 months of age. The anterior fontanelle is commonly referred to as the soft spot located atop a child's head. It allows considerable brain growth until it closes, generally between 12 to 18 months. However, the fontanelle may close on some children as early as 9 months. Which of the following is considered a late sign of hunger in the newborn? A. Crying. B. Sucking motions. C. Bringing hands to chin. D. Rooting. E. Chewing on the fists. The answer is A. Crying. Crying is considered a late sign of hunger. By the time the infant cries, they may be more difficult to console or to feed, especially if breastfeeding. Feed on cue when the infant is rooting, making sucking motions, or when they are frequently bringing their hands to their face or mouth. Which of the following should the nurse do if he or she finds a baby with irregular breathing? A. Check oxygenation through a portable pulse oximeter. B. Note the finding on the patient's chart. C. Check for oral obstruction of the infant's airway. D. Deliver oxygen through a simple mask. The answer is B. Note the finding on the patient's chart. It is normal for infants to breathe irregularly. Often, brief periods of apnea are present. Infants should breathe between 30 and 60 times per minute. For this purpose, noting the finding as a vital sign in the patient's chart is the correct action. No further intervention is necessary in response to a normal assessment.